3.
Gonna play some tackle football? Yeah, sure, let's do it. What happened?
You got a concussion from running into Angel.
Oh no, I got a concussion. What's a concussion?
A concussion happens when you experience a blow to the head. It rattles your brain and causes brain damage. We need to do a brain and neurological evaluation to determine the right treatment for your concussion. The concussion is a bruise to your brain, and we have to make sure you don't do any strenuous activity to prevent it from healing properly.
Can I still play football?
You can once it's healed. When you play again, make sure to use caution to prevent from having another concussion. Because if you keep getting concussions, recovery may require surgery. Multiple concussions can also cause problems with movement, learning, speaking, depression, rage, and memory loss. If you receive another concussion and lose consciousness, you have an increased risk of brain injury, and in some places you can die. Short term, you may feel dizzy, have memory loss, have nausea, headaches, tiredness, and you also may experience blurred vision, slurred speech, and difficulty concentrating, balancing, or coordination. In long term, you may experience severe memory loss, severe brain damage, or brain disease. If you get hit, it's possible to damage the 3 important parts of your brain. It's easy to damage your cerebrum, the part of your brain that controls movement, remembering, problem-solving, thinking, and feeling. If you get hit in the back of the head, where your cerebellum is, it can affect balance and coordination. If you damage your brainstem, it can affect you harshly since it connects the brain to the spinal cord and controls breathing, digestion, heart rate, and blood pressure. There's also studies in North Carolina where football players who suffer 1 concussion are 3 times more likely to have another one than other football players. I suggest you learn to tackle using strategy and not brute force. And in a recent study, 47% of high school players suffer a concussion each season. Try grappling and avoid slamming your head into each other. You can only take Tylenol, don't take ibuprofen or Advil. And you're allowed to sleep, but for the first 12 hours, make sure you're woken up every 2 to 3 hours and ask a simple question to make sure your brain is working properly. Simple questions such as, what's your name? And simple movement tests. And then you should be good.
Wow, this is serious, man.
Yes, it is.
Dude, what happened? I went to the doctor and they said I had a concussion.
You got a concussion like the football player Kurt Warner?
Yeah.
Can you still play football?
After I heal, I can play. We just gotta make sure that we don't get slammed.
Alright.
Okay, when you hear concussions, what do you think, and what sports do you think they come from?
Well, I think of essentially someone's brain being banged inside of their head in such a way that it can cause bruising or swelling of the brain. In terms of sports where that occurs, it's most prevalent in contact sports like football and hockey. But it theoretically could occur in any sport. People have had concussions in baseball from getting hit by baseballs or having collisions while running the bases. People have had concussions in basketball when they collide on the court. So, I mean, I think you're probably fairly safe in swimming unless you crash into the side of the pool, or track unless you run into something. But contact sports, sports where you have direct contact with other people, especially at high speed or with tremendous force like football, can be very dangerous.
Thank you. When you think of concussions, what comes to mind, and what sports do you think they come from?
Being knocked out, like getting hit in the head really hard, like fighting, like boxing, be like boom, punched your dumb, concussion. And then I think of like sports like boxing, because obviously you get punched in the face a lot, like MMA, football, concussions happen a lot. Maybe basketball, because you get hit in the head with the ball side hurting gun.
Concussions can also occur in other sports, such as basketball, soccer, ice skating, and figure skating, and also ice hockey and other forms of hockey. The most important thing is to just use precautions to make sure you keep your brain safe from having concussions. Just think about your safety first.